claw back on devolution. Health is a devolved function. And we realized that it was devolved, however, the resources have remained at the top. This last budget, 37 billion, was put to the national government. What business does the national government have to do with health when the people dealing with healthcare are the governors? So we have seen issues of clawing back on devolution, especially in the health sector. The other day you had the CS mention that they would like to now establish an emergency fund. I mean, it's the most obnoxious thing that can happen. If you have an emergency today in the village, do you go to Kenyatta Hospital in Nairobi or do you go to the dispensary next to you? You go to the dispensary next to you. So what the government should actually be doing is to strengthen primary health care so that if there is an emergency, then the person goes and is treated at the primary level. That's not happening. We are seeing the funds being retained at the national government level. It has been established that universal health coverage across the globe is the way to go. Now, in Uhuru's regime, there was 4 pilot counties that had been earmarked to pilot universal health coverage. I come from Nyeri, which was one of the pilot counties. Now, in that 1 year, we were able to conduct a research that then determined how many indigents, how many people cannot pay for healthcare. The same was handed over, we want to believe, to Ruto's regime. So we want to ask, what happened to universal health coverage? When they report about it these days, it sounds like a new phenomenon that they're not understanding. And ideally, all the research said was strengthen the primary healthcare system. Give more money to the dispensaries, to the health centers, and to the community health volunteers and the community health workers. One of the promises that they had made was that they would have a core pay system between national government and county government on how CHVs are paid. That we have not seen work because governors are the ones in charge of primary health care. The truth of the matter is that there's been a 200% increase of primary health care prices across the country. If you go to the dispensary next to you, and it's your homework this weekend, what you are paying 50 shillings to access, they call it a card. Tunalipa pesa ya card. It's a copy, really. Today is about 200 shillings. So there's a 200% increase of primary health care. So essentially, what does that do? It limits access, and it limits people from accessing healthcare. The collapse of NHIF, we have all seen what's been going on with NHIF. They had promised that, in fact, NHIF would be free by December of 2022. That is a promise on record. We have seen them dancing around the issue, cutting it up into different funds that really don't make sense. And all we are saying is NHIF requires just a little structuring, and it was working perfectly. If you listen to the CS, and she said that it was structured for employed people. That